welcome everyone. In today's presentation, we'll be diving into medical debt and why is this so important to learn about. So just to start things off, I'd like to share this quote with you from Dr. Rishi Manchada. And this is an opinion collected through a detailed report through NPR Health News. And it goes something like this. Dr. Rishi Manchada says, we have a healthcare system almost perfectly designed to create that. And I just want you to keep this in the back of your mind while we go through this presentation. Now, before we jump too far ahead, let me introduce you to our wonderful team that made this presentation a reality. I'll start. My name is Christian Hernandez, and my role in this campaign was campaign manager. A little about me. I was born and raised in the Bronx. I'm a junior currently at City College of New York, and I'm pursuing a bachelor's and master's in psychology. Personal goal of mine is to be a resource to my community, specifically when it comes to finance and mental health topics. So now I will pass it on to my team members to introduce themselves. Emma, the floor is yours.
Hi, everyone. My name is Emma. I am the policy lead of the healthcare campaign. I am a senior at John Jay College of Criminal Justice, where I am currently majoring in law and society with a double minor in criminology and interdisciplinary studies. I want to say thank you for joining us today and to speak about healthcare in our campaign. I'm passionate about policy analysis and advocacy, specifically within healthcare and criminal justice. And I will now pass it to Amima.
Thank you, Emma. Welcome, everyone. My name is Amima Wasim, and I'm one of the two engagement and field leads of our healthcare campaign. I'm a sophomore at the John Jay College of Criminal Justice, studying fraud examination and financial forensics. I am interested in attending law school in the future and hopes to become a lawyer. Thank you for joining us in our healthcare campaign today. And I will now pass it on to Zola.
Thank you, Amima. Hello, my name is Zola Jarrett. I'm the other engagement and field lead for our healthcare campaign. I major in multimedia programming and design, and I'll be graduating this fall semester. Thank you for allowing us the time to speak with you about the U.S. healthcare system. Even though this isn't my major, I do feel strongly about this topic, and I'll be passing it back to Christian.
Thank you, team. All right, so we'll now be jumping into our icebreaker. And so let's get started with this. Let me ask you all, what does medical debt mean to you? Now, there's no wrong or right answers here. We just want to hear your honest opinions. On the next slide here, you can join us and you can put in your answer, joining this Slido right on the left. Go to slido.com, then put hashtag 1176535, and you'd be able to populate your answers and we'll be able to see them directly here. And we'll take 2 minutes to write up what we think. Yes. Yes. Also, this is totally anonymous, so don't worry. Lots of money, stress, inhumane. Yes, yes. Totally agree with you. Now, lots of money. Yeah, because even if sometimes, as we will go deep into this presentation, even when you do have insurance, it can still cost lots of money. Inhumane. Suffocation, stress. All right, all right. See some good answers here. Okay. All right, 2 more participants. All right. Ridiculous. Yes, totally ridiculous. All right, 1 more participant. Sad. Yes. All right, I think that was it. And so, yes, just to wrap this little bit of an icebreaker, we will be touching a lot of these topics here, like the money part, the stressful part, painful, yes. And a lot of certain circumstances, there's people that end up with medical debt and they don't even know why they're in medical debt. And it doesn't seem very fair. If I could, I would join in there. Fair. It's not, it's very unfair. All right. So now I'll be passing it on so we can start this presentation. I want to thank you all for your honest responses here. And Emma, please give us some information about medical debt.
Great. Thank you, Christian. And also I want to thank you guys for participating in our icebreaker. It means a lot. So I will be starting with some fast facts about medical debt that most people might not know about. So from our friends at the National Consumer Law Center, currently in the United States, medical debt represents 58% of all debt in collections. That's a lot. Because of that debt, millions of individuals have had hindrances in their daily routines. About 1 in 7 people have said that they have been denied access to hospitals and doctors because of unpaid bills. That means they have been turned away for anything from a slight cough to major medical instances. In a larger picture, people struggling with medical debt have had to resort to stopping care and reducing spending on food to pay for their medical debt. Imagine that, like people having to stop buying groceries, attending to other needs in order to pay off medical debt that they needed. To move it forward, we're going to pass it now to Mima for more fast facts.
Thank you, Emma. So on this slide, there's fast facts about being uninsured and having lower income are associated with medical debt. So the chart to the right shows that the percentage of different households with high medical debt. To highlight, in households with below poverty status, there are 11.3% affected by medical debt. And we can compare this to those who are above poverty status with 3% medical debt. And of household with no or partial health insurance coverage, there are 8.5% affected by medical debt. This is compared to those fully covered by health insurance coverage with 2.9% medical debt. This proves that those having low income and who are uninsured have high percentages of medical debt compared to those with average income and are covered by insurance. Basically, if the amount of coverage that you have should not depend on your income, and even if it does, I believe that it shouldn't be this hard for people to be having this much medical debt, no matter how much they make, because healthcare and what you go through physically is hard enough. And I am now going to pass it to Zola for the next slide.
Thank you, Amima. Age is associated with being insured in medical debt. The chart on the left displays percentages of those uninsured by age groups in New York State. Because Young Invincibles focuses on ages 18 through 34, they happen to be the age group with the highest uninsured rates. In addition, 26-year-olds had the nation's highest uninsured rates among all single years of age, followed by 17.5% of 27-year-olds. And I will now pass it back to Christian.
Thank you, Sola. Now, let's take a look at the young adults and the medical debt collections. And, we see this chart here. There's a big amount of medical debt in different types of age groups. Those between the ages of 18 and 34 have the highest in medical debt, the third highest in medical debt. That's compared to the second highest from 35 years to 49, and the highest of them all from 50 years to 64 years. Now, with such high medical debt, the debt often goes into collections. They can't pay off, right? People get into this type of debt and, those bills don't wait for you to make an agreement with them or a plan. They usually just send them to collections. And the Consumer Financial Protection Bureau released a report in 2022 called Medical Debt Burden in the United States. And you heard that right, burden, because it is. And found that debt collection peaked on 27-year-olds, of whom 11.3% had a new medical debt bill enter collections in 2016. So that's a staggering amount. Those means that people trying to get a house, start a job somewhere else, they're writing all of this on them. They have debt on top of all the other plans they have in life, which, again, as the report says, it is a burden. So now, Emma, tell us about how someone's race can also play a role in medical debt.
Thank you, Christian. So to finally highlight how race is associated with being insured and medical debt. So the chart on the right displays insurance coverage in New York State by race and ethnicity. So as you can see, American Indian and Alaska Native have 11.6% uninsured rates, followed by Hispanic or Latino or any race at 10.3%, Native Hawaiian and or other Pacific Islander at 9.3%, followed by Asian, 6.6%, Black or African American, 6.1%. From our research, Black households, even with insurance, hold a higher amount of medical debt than non-Black households without insurance. So to reiterate that, Black households with insurance hold a higher amount of medical debt than non-Black households without insurance. The racial health and wealth gap is important to note, as households like this can be protected, but still acquire medical debt at an alarming rate. Insurance does not overcome the racial wealth divide and income inequality.
It's interesting that you said that, Emma, because I remember being so shocked by this when Emma presented this information. I never thought race is something that would negatively impact insurance. Race is something that should not negatively impact anything. However, to this extent, it's unbelievable.
Thank you, Mima. To continue, medical debt can cause individuals to put their health at a greater risk to avoid medical debt or to pay off existing medical debt. It feeds into a toxic cycle of risking their health by not seeking professional help to avoid more debt, causing their health to deteriorate even more. So if you think about it, individuals are getting more sicker thinking about how much debt they have to pay off. And there's significant research about race being associated with being uninsured and medical debt. To continue, there is disproportionate medical debt. The chart on the left displays individuals with medical debt by demographic. So as you can see, the highest percentages are non-Hispanic Black with 16% and Hispanic and non-Hispanic white with a tie of 9%. The overall analysis concludes that communities of color have a higher rate of medical debt with or without insurance. This affects daily routines and livelihoods such as credit reports and can lead to lawsuits to happen. It is important to understand that medical debt is disproportionate. So I understand that was a lot of information. However, we have some solutions. With these next few policies, we can stop medical debt from occurring and eliminate severe financial consequences. So the first policy that we have here is to pass the New York Health Act, A6058 S5474. The Pass the New York Health Act is an act to eliminate New York's coverage gaps and affordability burdens and provide comprehensive healthcare coverage for all New Yorkers. Essentially, this act provides for that establishment of New York Health Plan, a comprehensive system of access to health insurance for New York State residents. This policy is important because the Affordable Care Act that was previously passed, and hopefully everyone knows about, has helped in the past. However, there are still communities with much higher uninsured rates than others. For example, Black and Brown communities and immigration status have barred individuals from getting their healthcare needs. This act is currently being sponsored by Gustavo Rivera of the Senate and multi-sponsored by Jeffrey Aubrey, Maritza Davida, Patricia Fanny, and Sandy Gillith in the Assembly. Right now, it is currently in the committee, which means that I want everyone here to know about this policy, to spread the word about it, and to advocate for this policy. So next, we have the Medical Debt Protection Act. We recently got news that the Medical Debt Protection Act has officially been passed. After being passed by both the Assembly and Senate, Governor Hochul has officially signed the legislation effectively protecting patients with medical debt.
You see, this is what organizing and making your voice heard does for you. It makes things like these possible. So like Emma said earlier, please spread your voice. Make sure your voice is being heard and spread the word.
Thank you, Christian. The Medical Debt Protection Act is an act that ended unfair medical billing practices. That looks like requiring consolidated, clear hospital bills and capping interest on medical debt at 3%. Essentially, this act aims to protect consumers from surprise out-of-network bills caused by provider or plan misinformation and protect patients from unfair faculty fees. It's protecting you. Overall, this relates to the regulation of billing of facility fees. The policy was so important because medical debt contributes to the instability of New Yorkers, regardless if they have health insurance or not. This act was sponsored by Richard N. Gottfried in the Assembly and sponsored by Gustavo Rivera in the Senate. So what does this look like moving forward? What this means now is that patients would no longer fear the consequences of unpaid medical debt while seeking other medical care. We all get sick. We all have debts in some way or shape or form, but that shouldn't stop us from getting the care we need right now. Patients are protected from healthcare providers from placing home lines or garnishing wages to collect on medical debt. This policy is effectively protecting New York consumers and their financial health. So these are some of the most important policies that can change medical debt. And thank you for listening. Passing it now to Christian.
Thank you, Emma. And so, as you see, there's a theme here that we're trying to show you, and that's that accruing debt can happen to anybody. And so what does this look like realistically? And so many sacrifices were made because the medical debt was an issue. Now, the chart here on the left shows that what individuals had to do in the face of medical debt. For example, 63% of individuals had to cut spending on food and clothing. 48% of individuals had to tap out most of their savings. 40% had to get extra jobs. 28% of those people had to delay their plans of moving or education. And so medical debt does put a hold on your life, and it can affect every aspect of it. It could stop you from wanting to get a student having to get a new laptop for class. It can stop a parent from saving for their future mortgage or for their future child's education. And so we'll continue here. Here's some examples of what people go through currently without New York Healthcare Act. And NPR wrote about this issue, and we will go over some of the experiences people are going through right now with medical debt. And so, as you can see, here's some stories. We'll breeze through them real quickly. Allison Ward and her husband loaded up all their credit cards, borrowed from relatives, and delayed repaying student loans, only because they had a premature birth of their twins. And it left them with $80,000 in debt. $80,000 is, I believe, one semester or 1 year at Columbia University. That is astounding, $80,000. So they had to pick up extra shifts. They had to work day and nights. And it's as simple as starting a family that can push you into medical debt. It was not their fault. It was not Allison Ward's fault that this happened. But there's no net of safety for her to rely on in such an unfortunate instance. Here's another story, Arian Buck. You know, it's a young father in Arizona who sells health insurance. It's a little ironic, you know. They couldn't book an appointment because they had some outstanding bill, and it had gone into collections, and therefore they were not able to go book an appointment with a doctor to check for a dangerous intestinal infection. So there's a little bit of irony in that health insurance is so complicated and scary to understand, and even someone like Arian Buck, whose job is to sell health insurance, has no protection for instances where your life is in danger due to some unfortunate health-related issue. And I'm sure Arian Buck did not want this to happen to them. So now that we've heard some of these stories, I want to get a little personal. Sola has some stories to share with you all from people that our group reached out to here in New York. So Sola, tell us about some of the people you reached out to about their experiences with health insurance.
Thank you, Christian. So I decided to ask two people that I know personally, Erica and a person who wanted to stay anonymous. Both share their stories involving the healthcare system and how it's failed them, making them pay ridiculous out-of-pocket fees when they both have insurance. Anonymous's mother was eating one day, something that we all do, when her front tooth fell out. She frequently visits the dentist. She doesn't have any false teeth, and she doesn't have any ailments that could have caused this issue. So of course, she immediately went to the dentist to check out the issue. Unfortunately, she was informed that health insurance wouldn't be able to cover the repair. She ended up with a starting quota of $10,000. Now, what's the point of having insurance if it can't cover something this little? Next, we'll move on to Erica's story. Erica's stories differ. She believed that health insurance was the fairy godmother. She's under her mother's insurance, and her mom's a nurse. She had foot surgery, thankfully, and thankfully it was covered. But the daunting part of the procedure wasn't the procedure itself, it was the insurance, getting physical therapy covered. Her insurance only covered 6 sessions, but how would that work when her therapist wanted to see her twice a week? This is the harsh reality of people with insurance. Now I wonder how difficult it would be for people without it. I'll be now passing it to Amima.
Thank you, Zola. So this is another story of mine in addition to Zola. Many people struggle with healthcare and its effects. In addition to Zola, I gathered an experience of a close family member of mine. This is Tasneem's story. Tasneem is a 16-year-old girl who underwent back and forth surgeries at a young age. It affected her parents as they had to work another job or pick up an extra shift to reduce the debt and provide for their family. It was not covered by her insurance. We see this not only in younger age groups, but in a lot of older ones too. In the interview, she spoke about how this took an emotional toll on her as her parents were not home due to always working. This drove our family apart as she was an only child. She described this as difficult to deal with because of how stressed it made her parents. And Tasneem is one of the many stories that you're hearing today. Someone this young should not be going through a broken family due to something that wasn't her fault in the first place. Medical debt isn't something that should be making her issues feel like a burden when it wasn't her fault to begin with. I will now be passing it back to Christian.
Thank you, Amima and Sola, for sharing those stories with us. Now, you've seen the current reality without passing the New York Health Act. And you might say, hey, what can I do? Well, I have just the thing. We're going to do a call to action right now. And so you can see here on my screen, we're going to follow these 4 steps. And the 4th step does not count because that just means you're done. So I'm going to click on this link. And it's going to take us to this web page. And you can all see my camera. All right, we're gonna time it. I'm gonna time it. It's not gonna take us that long. So what we're gonna do is scroll down here. And there's gonna be a little box here. Oh, there you go, it's uploading. And you're just gonna fill up the box. You're gonna put your title with corresponds with you. I'll put Mr. First name, last name, address, and then sit. Phone, you don't have to put your phone if you wouldn't like that, but you do need to provide an email. You provide your email, and then you just click there, send email, and it's that simple. And you'll be prompted into another page that says, hey, you can send these 2 emails to your community boards, to the people that represent you in your area. So, oh, and let me stop the timer. It took 1 minute. Oh, it's a little blurry, but believe me, it took 1 minute, 9 seconds. That's how long it took. So now we're just gonna take a quick 5 minutes for you all in the chat to do the same. And you just have to follow that. And we'll be dropping the link on the chat. And for those who are done, just click on the chat, just so we know you're back. Just click done, and we'll move forward. All right, I see our first done here. Okay. We see one done, hopefully others finished it. I mean, we won't know either way if you did or did not. So if you did, thank you. If you did not, it's okay. You know, it's the little things, but there can be other things you can help with too. And so now we're gonna go ahead and open this to a quick Q&A. You can go ahead and write on the chat box. Is there any questions that anyone might have for us? Anything about Young Invincibles or this campaign? Okay, we have our first one here. Does medical debt go onto your credit report? Yeah, it does. It does go, and it affects your credit report when it goes into collections, because then it's seen as something where you're not paying. So they've sent that bill to someone to collect it, and that person or that entity is gonna make sure that it hurts in order for you to pay the bill. We have another one here. If so, is there a law or policy to get it taken off? If this is referring to the credit report, I believe it does. I believe there's nothing to take it off your credit report actively. Thank you for those questions, by the way. Those are good questions. See here, Morgan McGraw. What role do doctors and hospitals play in this, since they are the ones setting these excessively high prices? Well, there were no real experts on this, but I believe that that would have to be with how the hospital places their prices on equipment, services. But that that'd be for that's a talk between the government and the hospitals, and then that's where these laws come into place to cap the prices of things. So like different medicines, different procedures, that's where all these laws come into play and the policies. Okay. We can get back to you all if you have more questions on this. Just keep writing them down, don't worry. And so if there's any more questions, just write them in the Q&A. We'll have someone giving you an answer on there. But, I think personally for us, the reason why we chose this topic of medical debt, personally, I can say confidently, I was born poor. I think that's the most case for most people in my area, especially in the South Bronx. And it has an effect, when you have to, you have a cavity, right? As a kid, don't know if, as a kid, you don't think too much about it. But then if you tell your parent, hey, I can't chew, my tooth hurts. Oh, you see that expression in their face, and they're like, oh, this is another bill. Does insurance cover it? And it's like, oh, we have insurance, so why wouldn't it cover? And it's like, well. So that's why I feel like other my team members here, they also pick medical debt. All right, just to move forward.
I do want to highlight real quick, Christian, before we move on, what Ali Crewman wrote from CSS New York. Ali wrote, quick note from the CSS here, the past the Medical Debt Protection Act no longer exists. It's been split into 3 bills. One ending lines and wage garnishments that was signed, regulating facility fees, which passed the legislature, not yet signed, and simplifying financial assistance has not been passed. So the information was more or less there. However, it's not called the Past Medical Debt Protection Act anymore. So thank you, Ali, for highlighting that for us.
Yes, thank you, Emma. Now, just to close this off, I do want to say thank you to everybody for being here with us and engaging with us today on this issue of medical debt and how it can affect almost anybody. Even if you don't think it doesn't, if it doesn't, it does in some sort of way. I want to thank the YI staff for helping us with this presentation, and Lisa, our coordinator, for being the rock we could lean on when we needed her the most. I encourage everyone in the audience here, please stay engaged with this topic and follow Young Invincibles on Instagram, as you can see there, at Young Invincibles, and on Twitter, at Young Invincible. You can stay engaged with them, learn more about what's going on in your community. And I know it's raining today. Well, here in New York City, those who are joining us from other locations, it's raining here today in New York City. If it's not raining in your location, I wish you a beautiful rest of your day. And remember to take care of yourselves. We'll stay behind just for any Q&A that anyone else might have. But if there is none, please spread the word of YI, spread the word of ending medical debt. Whatever information you learn here, spread it with your friends, and have a beautiful rest of your day. See you all.
Thank you, everyone, for joining us today.
Oh, we have one last question here. Has the pandemic impacted medical debt? Was there a rise in medical debt due to COVID? Yes, I believe it has. Just because, people were laid off, people were not working during that time, and even though in some states there was some sort of action from their local governments to send checks. As you see in the news, they send checks out to help people, unemployment, but it didn't cover everybody. And so imagine those who did not have work already due to their condition, medical condition, or anything else, they were not. So yes, they definitely, COVID did impact medical debt, not just here, but all of America.
I'm gonna add on to that, if that's okay. An article actually said that 55 hospitals filed lawsuits against about 5,900 patients in 2020 during COVID. So that also created more medical debt because hospitals were going around filing lawsuits against patients in the worst times because the unemployment rate also increased. So that made people go out of their jobs, made it harder for them to pay, put them more in debt over time. So that didn't really help them as much.
Thank you, Amima. I think that was all the questions we have here. And for those remaining, thank you for staying behind.